According to the CDC, the leading cause of death for Texans is heart disease. Okay, it's scary to think the culprit is inside our own bodies. Today we have more opportunities than ever, though, but to live a life free of heart disease. Dr. James Choi, a cardiologist with Texas Health Heart and Vascular Specialist, joins me with more on how to keep your ticker ticking. Good morning. I love that. Keep your ticker ticking.
Jane, thanks so much for having me.
It's great to see you. Love this information. And let's get right to it. You are what's called an interventional cardiologist. Can you explain to viewers and to me what that means?
Yeah, an interventional cardiologist is a cardiologist who does 1 or 2 extra years of dedicated training on minimally invasive treatments for heart and valvular disease. It's particularly rewarding for me personally because the treatments that we do, be it stents or balloons for blockages or replacing valves, minimally invasive, have immediate impact on patients, and we can see the rewards almost the next day.
I can tell that you really are passionate about what you do and about helping people. And it's the blockages in the heart that you talk about a lot. How does that, a blockage, how does that affect someone's life?
So coronary artery disease is the leading heart disease in America. It's estimated that over 20 million adults have coronary artery disease. The cause is cholesterol and inflammation in the heart arteries, and it manifests itself by sometimes symptoms go unnoticed for many, many years, but others can develop shortness of breath, chest pain, and in the most extreme cases, heart attack or sudden death.
So what do you do if you're told you have a blockage?
The first thing and most important thing is get with a trusted physician. Our job as physicians is to help patients live longer and feel better. And in concert with medicines and mechanical therapies, that's what interventional cardiologists do. Mechanical therapies to treat blockages, whether it be stents or balloons or bypass surgery, we try to figure out what's best for the patients. And blockages, we can think of it like the Dallas-Fort Worth traffic. And many times it can get congested, and what are the best options and ways to unroot those traffic jams, so to speak.
I'm always so grateful for the advances in medical science and how much you can do for people these days. So you refer to a traffic jam, which I think is great. What is it like for the patient when you clear the traffic jam?
Well, the impact can be almost immediate. I'd love to share a story of one of my favorite patients, Mr. Reverend Robert Johnson.
Right.
He was diagnosed with heart disease and told he had 100% blockage, and it greatly impacted life to the point where he wasn't able to do a lot of things he could. He saw other doctors and they said, this may be something you just have to live with. And fortunately, he found us and we were able to open up his blockage and stent it, and he was back doing activities that he normally couldn't do, like playing ping pong and bowling.
And you know, we just assume, so many people are getting ready for retirement, we just assume that we're going to be able to do all those things.
Correct. So when I started interventional cardiology 20 years ago, we weren't doing treatments on patients that now, as technology advances, we're treating patients well into their 80s and 90s, and it's really for the goal of improvement of quality of life. And often patients are told that they have stuff that they have to live with, or you're just getting old. And if you feel like that's not the case, it's good to ask for a second or third opinion, because sometimes there's other options you may not know about.
That is really terrific. Thank you so much for joining us this morning. I bet you sleep well at night, know the work you do.
Last night I was on call. I didn't get to sleep that well.
Well, when you're not on call, I bet you do. Thanks so much for joining us this morning. Really appreciate your time. If you're interested in learning more about this, call the number on your screen, 866-885-1164, or visit thpg.org/heartlife, and we'll be right back.